said, my name is Emily Pearson, and I'm the nurse practitioner for our medical weight management program, in addition to our medical and bariatric surgery program. And then everybody will introduce themselves once I bring up the agenda. So what we are hoping to do today, so with our topic, it is weight loss myths exposed. So by exposing weight loss myths today, we're hoping to provide some answers and understanding to that really frustrating question of why can't I lose weight? So our agenda today is as follows. So I will be starting with just talking about some of the medical aspects of obesity and the hormonal changes that occur, and then it will go over to Elizabeth White.
I need to unmute
Elizabeth,
myself.
Yeah.
Yes. Hi, everyone. Good morning. My name is Elizabeth. I am the behavioral health therapist in the ProHealth Weight Management Program, and I'm going to spend some time talking about how behavioral health is important in all aspects of your health care, including when you are embarking on a health improvement project, such as losing some weight.
And my name is Andrea Von Helms. I'm a registered dietitian. I'm also the bariatric program coordinator. So what I'm going to share with you is a little bit about how nutrition plays a role in the treatment of overweight and obesity. And then we'll also share with you about our weight management program, how we might be able to help you. And then we'll go into our question and answer session. So feel free to put those questions in the chat as Ashley had shared before. And Emily, take it away.
All right, sounds good. So we really need to start with understanding what is obesity. So obesity is what the medical community calls excess body weight that attributes to poor health outcomes and poor quality of life. Obesity is a chronic, progressive, and relapsing disease, and it's characterized by the presence of abnormal or excess adiposity or fat that impairs health and social well-being. So really recognizing that obesity is a disease. It's not a cosmetic issue that is simply caused by overeating and a lack of self-control. So the World Health Organization, national and international medical and scientific societies, are all beginning to recognize obesity as a chronic progressive disease. And it's a result of multiple environmental and genetic factors. So obviously, looking at all of the things that can factor into obesity, we can say that it's a chronic disease that is very complex and multifactorial. So some of these factors are things that could impact you personally. You may or may not have control over them, right? Like our age isn't something that we have control over, but maybe our sleep habits or, at what time of the day we're eating are things that we have control over. But obviously there are a lot of different things that go into it, and a lot of these things are interconnected, so it's very complex. And then there are factors that exist in our communities, so that interpersonal area, neither you nor I can really change them, but to say that these aren't important factors in your wellness journey would be missing a really key part of that picture. And then lastly, there are factors that govern our access to care and the social climates in which we live. So from that, what we have written there, we can say health insurance is obviously a big part of the factor right now. So when we're looking into coverage for anti-obesity treatment, if we're looking at medication or surgical therapy, a lot of it depends on, what is covered and what can I afford. So really, we want to emphasize that everybody's needs are unique. Every body is different. It has different stories and different needs. So it's really important to understand all of that background so that we have a better idea of how to help you. So what works for one person may not work for the next person, and what's recommended for treatment for one person, it might be a very different recommendation for the next person that comes into the office. If you want to do next slide. Perfect. All right, so let's look at why is obesity treatment important. So obesity has a significant impact on our health. So this is a list of just some of the things that obesity can increase the risk for. So things like, we think about diabetes and high blood pressure, heart disease, different types of cancer. You know, you may not realize that mental health and sleep can be affected by obesity, degenerative joint disease, fertility, fatty liver disease. That's just to name a couple of them. But you know, what this is really telling us that by treating obesity, we could potentially improve, you know, a variety of other health conditions. So a lot of times when we're seeing patients with obesity and it's improving, you know, maybe you'll be able to reduce or go off of a blood pressure medication. We weren't necessarily saying we're treating your blood pressure, but that's an indirect effect that treating obesity can have. Quality of life is also a big part of this. So we want to be able to move independently and freely long term. You should be able to enjoy and do the things that you would like to do. Unfortunately, weight stigma and weight bias is something that is just an ongoing struggle right now, and it's truly unfair. But you know, things like weight loss and improving obesity can help you feel better as far as your mental health and your self-esteem. And Elizabeth will tell us more about that later. So we gear our treatment approaches towards health. It's not just cosmetic. So weight loss is an outcome, not the only one that matters. So at our core treatment, multidisciplinary care is the best approach. So there are 3 core areas for obesity treatment. That's nutrition, behavioral health, and then medical and surgical management. So the myth here is that I should be able to lose weight on my own. So in truth, we know that a multidisciplinary approach is much better. So when we're looking at all these different factors, you know, some of them are overlapping between nutrition, behavioral health, or between behavioral health and medical, and all of them overlap into you. So really treating multiple different aspects is how we need to treat obesity. So here at ProHealth, we do obviously work as a multidisciplinary team in order to provide the best care possible. And, you know, we understand that obesity is complex and it's multifactorial, and there's so many things that go into it. And, you know, really understanding that any one treatment by itself is not going to be nearly as effective as when they are all combined. So since there are many causes, we do need to address and treat as many of those causes as possible by working with providers in different specialties, and there are different ways that each provider can help. And then you can go to the next slide. Yeah. All right, so let's talk about, you know, now that we've talked about obesity, let's talk about obesity treatment. So the myth that we're looking at here is that, well, obesity medications are the cure, right? It's all over social media and the news right now that, oh, it's a magic injection, whether it's Ozempic or, you know, whatever is out there right now. So we really need to understand that medications are not the cure. So at the cornerstone of treating obesity, we've got our three core bubbles there. So nutrition, physical activity, behavioral health. So any way that we go about treating obesity, that is think of it like a pyramid. That's the base of our pyramid. We always need to start there. And then as the disease progresses, you know, treatment progresses. So whether it's adding on medical or medication therapy or surgical therapy. So let's say we're starting with our nutrition, behavioral health, physical activity, and maybe, you know, things aren't really going how we would like them to go. Things, you know, we're just not losing weight no matter what we're trying. So then, okay, we might recommend medication therapy because remember, this is a chronic progressive disease that may require long-term management, just like any other chronic disease. So it's not, obesity management's not something we work on for 6 months and then we say, okay, I'm good to go. This is something that's a long-term management and treatment. And, you know, within our program, we try to help you create long-term habits and strategies to help you with that long-term management. So as a fact, we need to remember from 2 slides ago with all the comorbid conditions, we know about the long-term effects of obesity. We may not know the long-term effects of the newer obesity medications, but we do know what health outcomes are going to be if we don't treat obesity. Not all therapies work for everyone. So really the myth here, we talked about medications are the cure, but the truth is that treatments really build on each other. We call this a stepped approach, and they're based on the disease state. All right, next slide. So there are a variety of treatment options, and we like to discuss average weight loss outcomes. So different therapies obviously yield different results, as we can see here. So as little as a 3 to 5% weight loss can decrease disease risk. Weight loss 5 to 10% is where we start seeing clinically meaningful changes to obesity-related disease. So some people need or want greater weight loss. Some people may not need as much, but if we're looking at here, lifestyle, that's kind of the core of our pyramid, right? We're looking at about 2 to 8% weight loss with that. There are a number of anti-obesity medications listed on here. Some you may recognize, some you may not. Phentermine, Wegovy, and Zepbound are probably three that are relatively common. Tirzepatide or Zepbound is the most recent FDA-approved anti-obesity medication. It was approved November of last year, so very recent. And we're seeing between 15 to 21% potential weight loss. And then obviously we have our metabolic and bariatric surgeries, sleeve gastrectomy, and a gastric bypass, which yield the highest average weight loss. I think that's everything for this slide. And then I'm going to hand it over to Andrea.
Hi. So Andrea, dietitian. The big question still remains, well, why can't I lose weight? What is keeping me from losing weight, even though I'm using maybe some of these therapies or working at it for a long time? So as a dietitian, a common myth I hear, or misconception I hear, is I could eat the same thing, or I should eat the same thing as insert social media influencer here, and that could help me lose weight. So while they do have some really great ideas, that isn't always the full truth. So at the basis of all weight loss plans, energy coming in must be less than the energy we spend in a day. So our bodies work in this energy balance equation. Weight maintenance happens when we take in about the same amount of energy that we spend in a day. When we take in more energy than we end up spending, we're going to store some of that extra energy, usually as fat tissue, sometimes as muscle tissue. So that's going to be stored for a little later. Weight loss happens when the energy we consume is less than the energy we spend. So when we're spending more energy than we're taking in, our body's going to use up some of its stores, its energy stores, and we'll lose weight. So theoretically, as long as our calories coming in are consistently less than our calories going out, you can lose weight. So the bottom line of this seems to be this energy balance where we have energy in versus out. There's actually a lot of factors that play into that equation. So all calories coming in are going to be due to the foods and beverages that we consume. Calories, I think of them just as a unit to measure energy, just like we use inches to measure length. Like calories, they're neither good nor bad, they just are. So calories, yes, that's how we measure our energy from food and beverages. But there's other factors at play. So we've got hormones from our gut and fat tissue, and they can influence us to eat more. We also live in what's called an obesogenic environment, meaning it's just a lot more convenient to eat foods that are higher in fat, higher in sugar, higher calorie, and not be as physically active. There's honestly so many more reasons why we eat and drink what we do, and that's why we work as a team, and we're kind of diving into that a little bit more today. So we'll hear more from Elizabeth a little bit more about that. So we can address really as many factors that influence our eating habits. Now, on the opposite side, the way that we spend our calories, there's a number of ways that we spend them too. So depending on our physical activity level, how active we are, somewhere between 60 to 95% of our calories are actually used for bodily processes that keep us alive. So the vast majority of our calories that we spend are for things like survival. So we're spending that energy on breathing and heartbeats and contracting our muscles in the GI system. Keeping up the same body temperature and so on. So factors that'll influence how efficient we are at spending that that energy for survival are our age, sex, height, and weight. So someone who is taller, younger, and weighs more will spend more calories for survival than someone who's shorter, weighs less, and is older. All right. So thinking of all of these different factors, and then there's more yet, everyone is going to have different calorie needs. So what is healthy for one person may not necessarily be healthy for the next. Looking at this chart and listening to my explanation, it sure seems like there's a whole lot of things that we don't have control over. Like we can't change our age or height or our sex. Changing our weight, that's what we're working on doing. And then we have genetics at play too. We can't necessarily change our environment all that much either. So while there seems to be a lot of things that we don't have control over, there are some things that we do have some relative amount of control over, and that's why they end up getting a lot of focus. So that's our foods and beverages and our physical activity. So that's why we often hear a lot of attention and recommendations like eat less and move more, but really there's a lot more to it. So I'll pass it off to Emily and she'll share some more.
All right, thank you, Andrea. So here we're going to look at, think of this as like a tug of war situation, okay? So on this left side, okay, we have weight loss, where we have decreased calories and increased activity, okay? So that's kind of what Andrea said at the end of her section there, was that when we hear eat less and move more, that's kind of what those two arrows are indicating. Okay, so we've got those two guys pulling that way. And then on the right side, we have weight gain working against us. Okay, so when we have weight loss, there are metabolic and hormonal changes that happen so that our body's actually working against us. So you will likely have a decrease in metabolism. Your hunger hormone is going to increase and your fullness hormone is going to decrease. And I'll discuss that a little bit more on the next slide. But really what we're trying to look at here for the myth is that obesity is just caused by a lack of willpower. Okay, well, we know by looking at this that there are other biological processes going on that make long-term, not only weight loss, but weight maintenance challenging, right? Because it's not simply weight loss. How often have we done the yo-yo of weight loss and regain and loss and regain? So this helps to explain that, okay, this is why it's so difficult to maintain when I do actually have weight loss, because we have other things going on here. All right, so these are some very important hormones that we need to talk about that a lot of people don't know about. So we have a hunger hormone called ghrelin that is made in our stomach. So when I talked about, that tug of war on the right side where we've got those three other guys pulling and that our hunger hormone increases. So with our hunger hormone increasing, we want to eat more. So we may not even necessarily be hungry, but we've got signals going from our stomach to our brain that's saying, no, we need to eat more. We need to eat more. We're still hungry, even though you may not physically need more. So if we've got increased hunger hormones, but then we've got a decrease in our fullness hormones. So the biggest one that we'll refer to is leptin, that comes from fat cells. There's also some in the pancreas and intestines. But if we have more hunger, but we're also not feeling full very quickly, what are the odds that we're going to overeat or eat more often or have difficulty with portion control? It's pretty high, right? So our brain is kind of just going off of the signals it's receiving, like, okay, hunger hormone's telling me let's keep eating. The fullness hormone hasn't kicked in and said, nope, we're done. So I'm just gonna keep going. So really we need to remember that obesity, yes, it has to do with these hormones, but it also is something that has to do, a big part to do with our brain too. And we're getting mixed signals that we shouldn't be getting. So we're going to talk more about this with Elizabeth.
All right. Hi, again, I'm Elizabeth. I'm the behavioral health therapist in the weight management program. The myth that we are talking about is, again, physical activity and nutrition are the only things you can control to lose weight. Move more, eat less. The truth is, it's a lot more complicated than that. There are a lot more things that you can do, a lot more things that you have control over that can improve your health and support weight loss success. Stress, all the stigma and bias, your self-esteem, the mind-body system that we're all making our way through the world in, and sleep. These are some of the things that we have some control over and that we can work on to improve our overall health and to support weight loss success. All right, next slide. Yes, okay. So I am a therapist. I come from the behavioral health side of healthcare. And what I most want to convey on this slide is that mental health is health. Mental health care is healthcare, right? All of these conditions, all these behavioral health conditions, depression, anxiety, obsessive compulsive disorder, alcoholism, post-traumatic stress disorder, these are all treatable conditions. These are treatable conditions that can get better with treatment. And as a part of your overall health, this has a influence on your weight because this is all one great big complex system that we're living in, right? So let's talk about the mind-body system. Okay, the mind-body system. Your mind and your body are one big complex system. And there are things that you can do through your brain to affect your body and things that you can do through your body to affect your brain. So having some understanding of how this whole system works is really, really important, okay? Because there are absolutely things that are happening in your brain, like negative thinking patterns, right? Like stress and worry and anxiety that can make it really, really difficult to engage in the activity that you want to engage in, to eat the food that makes you feel energetic and satiated, and to manage stress without using some of the food that is so readily available to soothe us, like the high sugar foods, high salt foods, high fat foods, right? So our mind and our body, it's all one very complex system. And there are parts of this that we have some leverage against, that we have some leverage through. Sleep is a really important part of that. Sleep is a cornerstone of your mental and physical health. And sleep is especially important when we're talking about weight loss. Okay, I want to go back to a slide that we saw just a minute ago. Next. Yes, okay. So sleep. Um, Sleep is so important when it comes to weight loss. It really can be the thing that's keeping the weight on, even if you're meeting your activity goals, meeting your nutrition goals, you're tracking everything you eat. Like this all it looks good, you're doing everything, the scale just isn't moving. Sleep can be the thing that is keeping that weight on you, and improving your sleep can be the thing that gets the scale to start to move. It is that important when we're talking about weight loss. Okay. One of the ways that sleep contributes to holding weight or gaining weight is if you have inadequate sleep or poor quality sleep. The next day, your ghrelin hormone, your hunger hormone, is elevated. Okay. And what this hunger hormone, it's called ghrelin, what this hunger hormone is telling your brain is, you're hungry, go get some food, especially carbs. Okay, so if you've had cruddy sleep the night before, your ghrelin levels are elevated the next day. All day long, your brain is getting that message. Go find some food. It would be great if you found carbs. Have you found any carbs yet? That constant message is going to your brain, no matter what you eat or don't eat. Right? At the same time, if you had cruddy sleep the night before, your leptin hormone, the fullness hormone, is depressed. Okay, so your brain will never get the message, you're full, you've had just the right amount, right? That message never gets to your brain. And so you can see if you've had a cruddy night of sleep the night before, the next day it's going to be extra miserable. trying to stick to, all the veggies and all the protein goals and all of these things. It makes it harder than it has to be. And gosh, you wouldn't want to do all of this work with improving your nutrition and your energy expenditure, finding physical activities and exercises that you enjoy, and you're doing all of this stuff. And then the not sleeping enough, not sleeping well, having inadequate sleep or poor quality sleep. It makes it not effective and makes it miserable to fight your way through, right? So sleep is essential when it comes to weight loss. The other important thing I want to mention about sleep and weight loss is there's a particular part of your sleep cycle where the actual changes in your body happen. Okay, the actual, like if you want muscle tissue to increase or fat tissue to decrease, the time when that actually happens in your body is during a particular part of your sleep cycle. And if you're not getting enough of that sleep cycle happening, then it's really difficult for any changes to happen in your body. So sleep, important, worth attention. Sleep is devalued in our society, and I am encouraging everyone to take a fresh look at sleep. One of the great things about sleep, I think, is that there are some low cost, low risk interventions to try, like earplugs. That's a pretty low cost, low risk thing to try that might improve your sleep. Right? And of course, there's many more, much more complicated things you can do for sleep. Sleep apnea is a really big deal. If you think you may have sleep apnea, please talk to your doctor, get a referral to the sleep center, find out if you have sleep apnea, find out how to treat it. Because sleep is a cornerstone of your mental and physical health, and adequate amount of sleep and quality of sleep is necessary for actual weight loss to happen. Okay, next slide. There we go. Emotional eating. For many, many, many of us, there are a lot of emotions tied to the foods that we choose. And there are different kinds of hunger that we experience. Some of this is crossing over into the dietitian side of things, but it's also the behavioral health side, so I can talk about it too. Right? We have physical hunger, our body's need for nutrition and fuel. We have emotional hunger, our body feeling uncomfortable, feeling distress, and soothing those feelings of discomfort with food. Right? There's a cycle that comes with the emotional eating. We're under pressure at work, and we come home from work and we feel that distress. We're uncomfortable, we're frustrated, we're anxious, and we walk in the door and we just appear in front of the pantry reaching for something. We didn't make this decision. It has been 3 hours since I last had nutrition. I think it is time to go. And none of that's happening in our brain. We're just compelled to go to the pantry and open it up and reach for something. Okay. Then we reach for something, we eat something that we don't need. We don't have the physical hunger for it. We don't need that food for our fuel or nutrition. And then we reach for the food that we don't need and we use it to soothe the distress. And then there's feelings of guilt and shame because we ate something that we didn't want to eat, or we ate more than we wanted to eat. These feelings of guilt and shame come next. Why can't I figure this out? Why do I keep doing this? Tomorrow's going to be different. Tomorrow I'm not going to reach for the double stuffed Oreos. Or whatever it is for you. For me, it's double stuffed Oreos. So understanding what's happening when you're experiencing hunger, figuring out how to investigate that within your body. Am I experiencing physical hunger right now, or am I experiencing emotional hunger? Is it a combination of both? What would actually solve my physical hunger? What would give me the nutrition and the fuel that I need? And what would actually help address the emotions behind the emotional hunger? Because food never solves emotional problems. These are two different things. Food doesn't solve emotional problems. Okay? But having this distress that you've been soothing with food tells you that, gosh, there's something there that needs some help, that needs some attention, that needs some work. Right? So you can learn how to recognize that when it's happening and come up with other strategies to manage the distress, to address what's really going on, all this good stuff. Okay, next. Self-esteem. Self-esteem is one of my favorite things to talk about. Self-esteem is important because your self-esteem is the foundation on which you stand when you are making all of the decisions in your life. Okay, this is where you are when you're making all of the decisions in your life, from what to put in your cart at the grocery store, to who you have in your life, to if you speak up at a work meeting or not. Your self-esteem is the foundation on which you stand when you make all of the decisions in your life. Okay, healthy self-esteem is having a balanced and accurate view of yourself. A balanced and accurate view of yourself. Healthy self-esteem is not thinking you're great, you can handle anything. Healthy self-esteem is having a balanced and accurate view of yourself. Now, that doesn't sound like it would be such a difficult thing to achieve, right? It's just reality based. You want to be accurate and balanced, but it is. It can be a very complicated and difficult thing to achieve healthy self-esteem, but this is worthy of attention. This is worthy of time. Right? This is worthy of investment because the emotions that are tied to food, how we're using food to cope, the guilt that comes with the emotional eating cycle, these are all things that you can have some oversight of and that you can start to change those patterns, right? Next is motivation. So motivation is a process that initiates, guides, and maintains goal-oriented behaviors. Okay, so motivation, and there's lots of parts to this definition. Motivation is about starting the healthy habit, the behavior that you want, maintaining that healthy habit and the behavior that you want, but motivation only works if it's related to a goal. You have to have a clear goal in mind. Are you crystal clear about what your long-term goal is? Are you crystal clear about your medium-term goals and your short-term goals? They have to get out of your head and onto paper, or out of your head and onto, a goals app on your phone, whatever it is that works for you. Motivation can't sustain long-term if you don't have a clear goal. So this is something that you have some power over. You can spend some time really getting clear about your goals. A structure for goals that we like to use in the weight management program is SMART goals. SMART goals, right? And if you Google SMART goals or how to make a SMART goal, you'll find all kinds of information about it. SMART goals are specific, measurable, achievable, relevant to your long-term goal, and time bound. Okay, SMART goals. So again, if that's interesting to you, if you think that's something that could really help you move forward with your health, with your weight loss, Google it and find out more information about it. Okay, next. What was the next one? Okay, now I'm going to pass it over to Andrea, our fantastic dietitian.
Thank you, Elizabeth. I also like talking about motivation too as a dietitian, because when I have a better understanding of what your motivations are and what your goals are, what it is that you want to achieve, we can tailor your nutrition approach to that. So a common myth I hear that relates to this actually is I have to eat low carb to lose weight. So if your goals, for example, are to be more active or to manage a certain disease state, your nutrition needs may need to change to fit that. So if you wanted to be more active, you might actually, in some cases, need more carbs to exercise very effectively, to have that energy and that fuel to perform that kind of exercise work. And also, if you're managing certain types of diseases, for example, working on managing your blood sugars, working on getting them more even, you might want a more consistent amount of carbohydrate intake, right? Also, your nutrition needs will vary based on your preferences, your likes and dislikes, the accessibility that you have to food, the cost of food, what is available to you, and what we have the time and the energy to prepare. So the truth here is that the best nutrition plan is one that is safe and healthy for you, but it's also one that you can follow long term. So that eating pattern It could be high protein and low fat. It could be low carb and high fat. It could be low protein, low fat. Technically, the macronutrient distribution does not matter for weight loss, as long as the pattern you are following allows you to reach your desired calorie range. So that's something that we would work on an individual basis of what is that right pattern, that right distribution for you. And we'll look for ways to help you reach your calorie goal. I often talk about what to eat. It's also a little bit about why we eat and how to eat, not just about calories all day long, right? Another myth I hear is that I can only lose weight at eating 1,200 calories per day. So I want to preface this with 1,200 calories is honestly a really low number of calories, right? So we spoke a little bit earlier about that in order for weight loss to happen, calories must be less than the calories we spend in a day. And that is true. However, too much or too little of a good thing isn't good. So Emily shared that dietary weight loss does cause some biological responses. Think of those hormones, that tug of war that can continue long term and can contribute to weight regain. And one of those responses affects this energy balance equation. So when a person loses weight, right, the body says, I'm starving. I'm not getting enough calories. I'm below my base calorie needs. I need to fix this. So in order to save some calories, the body is going to adapt. Our bodies are really good at trying to save us. It wants us to survive and thrive. So the body's going to adapt. So its energy that we put out is decreased. Now we're in a state where we are more likely to gain weight because we have more energy coming in than is going out, right? So enter that tug of war, right? We're at odds with ourselves. So in order to continue losing weight, or even just to maintain weight loss at this point, the person who is working on weight loss will need even fewer calories than someone who was even of an equal body size and height and age who had never lost weight before. So we have to cut the calories down again, right? Eating less like this is really hard to do when we're already eating so little. So that hunger is certainly going to increase, and it's going to be very challenging to continue on this pattern. So another part of this biological response that involves changes to our fat metabolism, how we use fat for energy. So there is a reduction in the body's ability to burn fat for energy. So when we take in fat from foods, even the healthy fats, we're more likely to store that for later. And there's an increase in the capacity, the ability for fat to be stored as fat tissue. So we're more likely to store some of that. A lot of our health comes from keeping and maintaining our muscle mass. So you can see how this could be a little bit problematic. Right. With dietary weight loss, the amount of dietary fat in the body is reduced by approximately 50%, which is quite a bit, quite a significant reduction. In addition, dieting reduces the amount of fat that the body is going to burn for fuel when we're doing even low-grade activity like walking, cleaning the house, fixing dinner, or even working on a computer. And the reduction in the amount of fat that is burned for fuel, followed by dietary weight loss, makes fat even more available to be taken up by fat storage deposits. And then we just end up with a cycle of weight regain and even more difficult to lose weight because we don't have as much muscle as we did before. So we're caught in this challenging spot, right? Why can't I lose weight? So the way to combat this is that we don't want our energy intake to be far below or much below at all our baseline calorie needs that we use for survival. So we refer to that baseline calorie needs as our basal metabolic rate, our base calorie needs for survival. So that'll help with preventing that signal of I'm starving. That'll start that cascade that I just described. So the basal metabolic rate is our estimated calorie needs that you would need in a day for complete total survival for your heartbeats, the muscles in the GI system, our breathing, all of that stuff. So if you laid completely still all day long, these are the calories that you would need in a day. At minimum, you need those. It's probably a lot more than 1,200 calories a day. Okay, so that's something that you would have tailored to you and it would be an individualized recommendation of what that level really looks like. Okay. All right, so segueing, I think we've each talked a little bit about how nutrition, physical activity, and even from a medical standpoint, how our hormones and body signals can be impacted and be part of the picture in addressing why can't I lose weight. So our program, our Pro Health Weight Management Program, we have two arms to it. So we have a medical weight management program. We also have a metabolic and bariatric surgery program. So I love the opportunity. Thank you for being here to share with you just how we could help you too. So in our weight management program, we're currently accepting patients who are at least 18 years old and have a BMI of at least 27. So they're already in that overweight category, so we can help you. We're currently accepting patients who have commercial insurance, but our program is a self-pay option. We also have a metabolic and bariatric surgery treatment program where we are performing Roux-en-Y gastric bypass or a sleeve gastrectomy. This might be a treatment option for you, if not now, maybe in the future. I just want to offer it as something that we do have if it's something you're looking for. We are currently located at Waukesha Memorial Hospital, and that's where we'll do our in-person visits. We also do a number of virtual visits. So kind of like today where we're meeting over a WebEx, we do virtual sessions for both individual and some of our group sessions. Our standard program, our kind of gold standard, is the 6-month medical weight management program. So we take that interdisciplinary approach, as Emily had described earlier, where you work with a dietitian, such as myself, behavioral health therapist, such as Elizabeth, and nurse practitioner, such as Emily, and we work together as a team to address obesity and your health from as many angles as we can. It's a combination of individual appointments, group sessions, a gym membership, and you get clinical workup. So in these individual appointments, you'll work with the nurse practitioner every single month of your 6-month program. You'll even see her twice in the first month because we really want to get to know you very well. As we talked about before, this disease is really complex and there's a lot of layers to it. So we really take time getting to know you. You'll meet with the dietitian at least for 4 times. We do follow-ups at the first, and then at months 2, 4, and 6. And then you'll meet with the behavioral health therapist, Elizabeth, at least twice. So at the first month and then at the 3rd month. What I find is also really special about our program is the group sessions. So kind of like today where you're able to interact and ask questions, there's a lot of learning that happens there. So every month we have a different nutrition focused session and a different behavior health focused session. You're also able to get to know other participants who are going through similar things as you are and share with them things that are working for you. And you also learn from them some of the tips and tricks that I might have never even heard of that they are finding to be really useful and beneficial. So I see a lot of great growth and learning happening from those. And you can pick and choose which times you would like to attend those sessions. They're all currently held virtually. You'll also have included a 6-month membership to the Westwood Health and Fitness Center. They're a fantastic location located in Pewaukee. And what's really special about them is they have more of a medical lens to that fitness center. And I know it's a really great welcoming atmosphere. Plus, we do clinical workup of labs both before at the very start of the program and follow up at month 6 at the end of the program. And then I'll pass it along to Emily and she'll share how specifically the nurse practitioner helps.
All right, thank you, Andrea. So as you know, my picture is listed there, and then we have another nurse practitioner, Nicole Crovello. So there are 2 of us, and you could see either one of us. But when we see you, we'll do a thorough physical exam. We obtain baseline lab work. If we feel like we need to get additional labs to look further into what's going on with you, we may recommend that as well. And then we get a number of detailed measurements. So we check vital signs like your blood pressure and your heart rate. We check your, not only your weight, but we look at body composition. So looking at things like, okay, well, how much fat do I have versus how much should I have, right? Because we've learned that the amount of fat we have can really impact where we're at in the disease of obesity. So we really need to look at that. And then Andrea had talked about that basal metabolic rate, our baseline amount of calories. So we get an estimate for about where we are at for that metabolic rate. And then Andrea does a further calculation with you at her visit. But then we check neck, waist, and hip circumference. When we see you month to month, we do health coaching where we'll address multiple different things, nutrition, physical activity, sometimes stress or sleep if that's a struggle for you, medication management, and then we'll have an evaluation with you for possible weight loss medication therapy. Again, it depends on where you're at in that stepped approach to the treatment of obesity. And then I will hand it back to Andrea to discuss what she does.
So I also have a colleague, her name is Lori. She is absolutely a fantastic dietitian and I'm honored to get to work with her. The way that we help you from our dietitian lens is we come up with collaboratively a nutrition game plan together. That's what we do in our first visit, and then our follow-up visits, we talk about how to put that nutrition plan into practice. A lot of my patients come in saying, like, I know what it is I need to do, I just need help doing it. So we talk a lot about that too. There's no one set diet that we prescribe. It's all very highly individualized. We do often start with a baseline approach using this balanced plate method, this little picture I have here, and we tailor it for what your medical nutrition needs are, what your preferences are, and your lifestyle. Because whatever we come up with together, I want it to be things that really work for you and your life and that will work for you far beyond us and our time together. I also mentioned our group sessions. So these group sessions, they're held virtually and you'll attend it once monthly, although they're offered multiple times, and you can choose that day and time that works best for you. I love running these group sessions because of the interactive discussion that happens throughout, where we talk about things like meal planning and grocery shopping and eating out, and what about even those social eating situations where we can't look at the menu ahead of time, and how do I respond to so-and-so who's like pushing food on my plate even though they don't mean to do it, and responding to that. And then we even talk about ways to relate with food. We talk about mindful eating, which helps us be more present and enjoy food that much more. And then Elizabeth, she's a great help too. So share more.
So in our weight management program, there are two behavioral health therapists there, myself and Melissa. We have individual meetings in the program where we will talk about your individual struggles, your individual needs. How do you handle stress? Do you think of yourself as an emotional eater? You know, what other sort of things are really getting in the way of your health and your weight loss, right? We do also have behavioral health groups. So once a month in our weight management program, everyone attends a behavioral health group. Similar to the nutrition groups, there's a different topic every month in our behavioral health group. And in the behavioral health side of healthcare, we know that there's some magic in group work. There's some magic there. Some really neat discussions can happen in a small group setting. So we talk about a lot of the things that I just mentioned previously in more depth, like self-esteem, mindfulness, the mind-body system, sleep, emotional eating, motivation, what kind of motivation will help you sustain healthy behaviors and weight loss long term, all of that good stuff. And we do try to correlate our behavioral health and our nutrition groups so they make sense together. We're supporting each other. Yeah, good. And I will also mention that the MyFitRx program is a special like add-on program available at Westwood Health and Fitness. I think this is a really useful thing for people who maybe are not familiar with working out or with the gym, or they don't know how to start when it comes to exercise. So MyFitRx is an add-on option over at Westwood. It includes a personal trainer. That's the word I'm looking for, a personal trainer who will develop a plan that meets your own individual goals. There are small group sessions available to you twice a week for that trainer to be there and to encourage you and to get you to the next level, to help you continue to learn and expand and grow. And so I think that can be a really helpful thing for people.
So if you're ready to get started and you're ready to take the next step and join us, we'd love to have the opportunity to get to work with you a little bit more. You can request a referral for the Pro Health Weight Management Program from any Pro Health provider, or you can go to our website, prohealthcare.org/weight management, and click request a consultation. And then we'll have a quick 30-minute phone call with you to talk a little bit more about our program, answer your questions, maybe talk about what possible treatment options could be for you, of how we can help a little bit more, and then talk about really getting started.